Easily find, book, and manage your travel nursing assignments with the AMN Passport app. Download today. What other types of like labs or assessments and stuff are like, things that are specific to your unit or your job, like cardiac specific, other than like, troponins, like looking for bleeding post-op?
Yeah, troponins and EKGs are huge. The TAVRs all get those. They get them when they come up. They get them the next morning. With our vascular patients, our neurovascular assessments are very important.
Checking the pulses.
Checking pulses.
Yeah.
Lots of that. Even like for all the cath lab patients, like the neurovascular with the pulses and all that. That's probably our most popular frequent assessment is neurovascular pulse checks.
Yeah.
And groin checks. But
can you think of any like times where you had like a good catch or like where you like found something post-op?
I would say, so I was charge nurse this day, so it wasn't my patient, but we had a patient came from the cath lab and they had a TR band on. And this was a couple months ago. And, I was like in there just helping her out, and I like just looked and I'm like, that hand looks a little purple to me. And, I was like, I walked out of the room. I'm like, hey, like, the hand looks purple. Like she has like a pulse. I can feel a pulse, but like, I think that TR band is like on too much. Right.
Yeah.
And like, because she had just came fresh out of the cath lab, I didn't want to just like take all the air out.
Want to start spewing
I didn't want to start spewing.
Yeah.
So,
right. Yeah.
We're trying to get in like contact with the doctors or what, like, we're like trying to get in contact. It takes a while to get in contact with them. I like get our educator and I'm like something's up.
Something's not right here.
And then she was also developing, I don't know if I think it was like a hematoma from like an IV that had infiltrated or something on her arm that had gotten like much worse than she got up here. And I think like by the end of the like shift, she ended up in the ICU for like the night because it was like,
I think so. Yeah.
Oh, man.
It was like, well, I was like, well, I'm glad I noticed that her hand was purple because it escalated kind of quickly to be like, but like you didn't want to jump to like taking like all the air out of it without the doctor, without contacting the doctor, because then there's no pressure on that site. But the TR band was indeed on too tight.
Yeah, and then there'll just be people that like come up from their vascular procedure, and then like they had pulses when you first came up, and then you go to do your next check, and all of a sudden they're gone, and turns out their stent already reclotted off. We've had that happen.
Oh yeah,
a few times,
Oh,
and then they got to rush them back to surgery because they're not getting blood flow.
Yeah,
again.
we had a patient that was literally like on our floor for like 2 hours, and then they were like came up from like this long surgery, and I think the doctors were all already aware that there were like some complications, and they're like, we're specifically like looking out for this, and then like I think without like 2 hours they were whisked back off to the OR to do it. Yeah.
My gosh, that just like makes you really validates how important our jobs are as far as like, acute, like being the eyes, because like the docs are not doing the assessments.
Yeah.
Like,
there's no way they can, be up there every 15 minutes doing pulse checks or like even like every 2 hours. They've got a billion things to do. So it's like,
like your assessments matter.
Stuff, people could lose limbs and stuff.